Welcome to Dental Bites, a way to get to know who we are by what we do. I'm Shannon D'Angelo, Dr. Giordano's former assistant and current office manager. Our topic for this Dental Bite is TMD, or temporomandibular joint dysfunction. Are you one of the 60 million Americans who suffer from temporomandibular joint dysfunction, or TMD? Or should I ask, are you one of the 60 million people in America who suffer from headaches, face pain, jaw pain, tooth grinding, and those are just some of the symptoms of TMD. A recent study revealed that 53% of people with TMD suffered from some level of depression, while 22% had symptoms of fatigue and/or insomnia due to disrupted sleep patterns. So let's learn a little bit about the temporomandibular joint disorder. First things first, you have two TMJs. They're here and here, located right in front of your ears. They're ball and socket joints, just like the majority of joints in your body. However, what's unique about them is they are the only two joints in the body that have to work at the same time. In other words, I have two elbows. My elbow is a ball and socket joint. I can use this one as much as I want and never have to use this one. But every time you speak, swallow, and chew, you have to use both of those temporomandibular joints at the same time. So what does that mean? They take a lot of wear and tear. The two main causes of TMD are injury and a poor bite relationship. That is, the way your teeth come together. So the dysfunction can be acute, which means recent, or chronic, which means it's been going on for a long while. TMD is a degenerative disease. It progresses in stages that, if left untreated, will significantly worsen until you are forced to seek treatment because you can either no longer stand the pain or your jaw cannot function properly. For instance, for some patients, they can eventually be left with the inability to bring their front teeth together ever again. This is a very unfavorable condition. Patients are often told that there's nothing that can be done for TMD. And then there are those clinicians that say they treat TMD successfully while they actually cannot. Diagnosing and treating TMD requires the dentist to have extensive and ongoing education as well as infinite patience. Treating TMDs is not something that can be learned overnight. Dr. Giordano has been studying and treating temporomandibular joint problems for more than 20 years. Every year he attends continuing education in TMJ therapy, and to date he has more than 1,000 hours accrued. It also requires knowledge in several other health disciplines, as patients will often have symptoms that are related to the TMD. It also requires knowledge in several health disciplines, as patients will often have multiple health issues that are actually related to the TMD. Dr. Giordano is part of a team of health professionals that work together to treat our patients. It's because of his extensive training, education, and the team approach when necessary that our success rate is very high. The most important thing to remember is that you must treat the cause and not just the symptoms. That being said, there are different causes of TMD. It's important to note that if you don't treat the patient's specific cause of TMD, you can actually make them worse. There is no one way to fix TMD. Treatment varies from patient to patient. Every patient needs to be thoroughly evaluated and properly diagnosed. Once this is done, an appropriate treatment plan can be formulated and customized treatment can begin. We allow your body to dictate the treatment it needs. We have a very large range of treatment options. That is to say, we have many different types of appliances as well as multiple types of physical therapy modalities that we do right here in the office. Most of the information on the internet are attempts to relieve the symptoms. Well, while that can be helpful, it's certainly not going to relieve the cause. The longer you do not treat the actual cause, the worse your TMD will become. Is an attempt to relieve your symptoms. While that can be helpful, it certainly will not treat the cause. And the longer you let the actual cause untreated, the worse your TMD will get. So what's your first step? Call the office and set up an initial appointment. At this initial appointment, we will do brief testing and an exam. If you are in pain, you may be given a temporary appliance along with emergency instructions for pain relief. We may also recommend one or more physical therapy modalities to get you immediate relief. At this visit, Dr. Giordano will let you know whether he can help you or not. If so, you would need to return for thorough records. A diagnosis will then be made and treatment can then begin. You don't need to suffer any longer. Seek treatment and get control of your life again.